Here is a statistic that should stop every man over 40. By 45, the average man has lost nearly half an inch of height, not because his legs shrunk, because his spinal discs are dehydrating and collapsing under gravity year after year, like a sponge left in a sun. And here is what most men do not realize: that height loss is not cosmetic, it's a biological warning signal. Each millimeter your vertebrae compress is a millimeter closer to nerve impingement, disc herniation, and chronic pain that does not resolve on its own. I'm Dr. Ngoundi, a medical doctor and a fitness enthusiast. And in the next few minutes, I'm going to show you exactly what is happening inside your spinal after 40 and the 5 biological decompression maneuver that can reverse it. Your spine is not a stack of bone, it's a hydraulic column. Between each vertebra sits a disc, a fluid-filled cushion that acts as a shock absorber. Think of each disc like water balloon. When the balloon is full, the vertebra stays separated. Nerves have room. Movement are smooth. But here is what happens after 40. The proteoglycan, which is a molecule that holds water inside your disc, decline. The balloon therefore loses pressure, and gravity spends 16 hours pushing those inflated cushions together. Now, if you sit for a living, and most men after 40 sit 6 to 8 hours a day, you are making this worse by a factor of 3. Sitting alone creates 40% more intradiscal pressure than standing. That is not an opinion, that is simply biomechanic. The result, your lumbar disc, L4 and L5 especially, get squeezed like a vise. The fluid leaks out, the space for spinal nerves shrinks, and one morning you wake up, you cannot touch your toes, and you think, I'm just getting old. Well, the biology says something different. You are not aging, you are compressing, and compression is reversible, but only if you move with the right mechanic. Move 1 targets the muscle most men have never heard of, but this muscle is silently destroying their lower back, the psoas muscle. The psoas originates on the lumbar vertebral L1 through L5 and attaches to the inside of your femur. It is the only muscle that connects your spine directly to your legs, and when you sit all day, this muscle shortens. It pulls on your lumbar spine like a taut rope, pulling it forward into an anterior pelvic tilt, compressing the posterior disc and loading the L4-L5 junction exactly where herniation happens. Here is the maneuver you should apply. Half kneeling position, back knee on the ground, front foot flat. Now, and this is critical, tuck your tailbone under. Think posture pelvic tilt. Squeeze the glute on the kneeling side. This is what 90% of men get wrong. They lean forward and arc their lower back, which reinforces the exact compression pattern we are trying to reverse. Once the pelvic is tucked, reach the same arm overhead and laterally lean away from the kneeling leg. You will feel a deep release in front of the hip. That is the psoas muscle releasing its grip on your lumbar spine. You can hold it for 45 seconds. Breathe through your nose. And here is what is critical. Nasal breathing during these stretches activate your parasympathetic nervous system, lower cortisol, lower inflammation. Your disc hydrate faster in a low cortisol state. This is not just stretching, it's a spinal biology. Before I move to move 2, if you are a man over 40 and your back is stiffest in the morning, drop the word morning in a comment. If it tightens up after work, drop evening. I read every comment and I will reply with which of these 5 moves you should prioritize first. Now let's move to move 2, the thoracic unlock. Move 2 addresses the region most men ignore completely. The thoracic spine, your mid-back. Here is the mechanism. When you sit at the desk, drive, or look at your phone, your thoracic spine round forward. Over years, the facet joint stiffens, the rib cage locks into flexion. And here is where this gets interesting. Your thoracic spine is designed to handle rotation and extension. When it cannot do that job, the lumbar spine is forced to compensate. Your lower back was built for stability. It was not built to rotate. But when your mid-back freezes, your lower back takes a force it was not designed to handle. During every deadlift, every golf swing, every time you pick up your child. And here is what you should do. Sit on the bench or the chair. Clasp your hands behind your head. Place your shoulder on the bench, back rest. This is like a prayer position. Now sink your chest towards the floor while keeping your lower back flat. You are opening the thoracic facet joint one segment at a time. Hold the bottom position for 2 breaths. Come back up. Repeat 8 times. This is not about flexibility, it's about restoring the movement that your lumbar spine has been forced to absorb for years. Unlock the ribcage and the lower back. Stop taking the punishment. Now, the movement 3 is the sciatic nerve floss. Move 3 is the one that surprises most men because sometimes the tightness in your leg is not a tight muscle, it's a trapped nerve. Here is the anatomy. Your sciatic nerve exits your lumbar spine, L4 through S5, and travels through your piriformis muscle down the back of your leg all the way to your foot. When surrounding tissue becomes inflamed or scarred, and it does after years of sitting, the nerve gets adhered. It can no longer glide freely through its canal. And when you move, that nerve pulls instead of slides. If you have ever felt a bolt of electricity down the back of your leg when you bend over, that is natural tension, not a hamstring stretch. It's a trapped nerve. The maneuver you should apply is the following. Sit on the edge of the bench, extend one leg out straight, ankle flexed, toes pointed towards your face. At the same time, look up towards the ceiling. Now reverse. Flex your foot, point your toes down, and tuck your chin to your chest. You are not stretching the nerve, you are flossing it. Slide it back and forth through the tissue tunnel, breaking adhesions and restoring glide. Think of it like a dental floss moving between teeth. 10 repetitions per leg, slow and controlled. If you feel a tingling, that's normal. But if you feel a sharp pain, reduce the range. Move 4 targets the muscle that goes out when you reach for something awkward and you cannot figure out why. The quadratus lumborum or the QL. This muscle sits between your 12th rib and your iliac crest, your hip bone. It is a lateral stabilizer. It holds your spine upright when you lean sideways. And in men who sit all week and then go play pickups or do yard work on Saturday, this muscle chronically locked short. When spasm, you cannot stand upright. You lean to one side. And most men think they threw their back out, when actually the QL simply sized up from being shortened for 5 days straight. The maneuver here is simple. Stand next to a wall about arm's length away. Cross the leg closest to the wall behind the other. Reach the arm closest to the wall over and laterally lean away. You will feel the stretch between the bottom rib and your hip. This opens the space between your 12th rib and your iliac crest. It decompresses the lateral column in your spine, the column that takes the hit every time you rotate or lean. Hold for 45 seconds per side. This is the ultimate insurance policy against that sudden back tweak that puts you on the floor for 3 days. So now, this is the 5th move, the spine decompression. This move is the most underrated maneuver in spinal health, and it takes almost zero effort. Lie on your back, flat, place your lower legs on the bench or chair or even a couch so your knees are at 90 degrees and your hips are at 90 degrees as well. This position, called the 90-90 position, neutralizes the psoas pull entirely. Your lumbar spine drops into its natural curve. The posterior disc open. And here is what happens. Spinal fluid re-enters the disc through imbibition. The same mechanism that makes you taller in the morning than at night. You should hold this position for 3 minutes. Breathe nasally. Let the gravity do the work. This is not a passive rest. This is active spinal rehydration. So after all this, here is the protocol you could apply. 3 times per week. Not 5, not 7, but 3. Move 1. the Psoas decompression, 45 seconds per side. Move 2, the thoracic unlock, 8 repetitions. Move 3, the sciatic nerve floss, 10 repetitions per leg. Move 4, the QL release, 45 seconds per side. And move 5, the spine decompression, 3 minutes. This is less than you spend scrolling your phone before bed. And the biology is clear. Men who decompress their spine regularly restore dehydration, reduce nerve impingement risk, and recover height. One study published in Spine Journal showed that regular spinal decompression exercises restore an average of 3.2 milliliters of disc height over 10 weeks. And that is 3.2 millimeters of space for your nerve to breathe. Well, if this video shifted how you think about your back pain, drop decompress in the comments below. It tells me you are committed to fix your spine, not just managing the pain. And before you go, one medical directive for your next checkup. Ask your doctor to check your lumbar spine mobility and hip flexor length. Most men over 40 barely have this assessed, and it only takes 2 minutes. Train with your biology, not against it. I'm Dr. Ngoundi, and I will see you in the next video.